So healing can be like watching paint dry. Now, no one should watch paint drying. So what I mean by that is when I am speaking to patients on a daily basis, part of what I talk about with patients is not over analyzing their results too soon. So in the early days, you will be obsessing and fixating on the area you've had treated. That is really normal. And, it's good to monitor. It's good while your wounds are healing to keep an eye on them for any symptom or sign that something might not be right. But when you get to about 6 weeks down the road, the thing that I find really hard to try and explain to patients is at 6 weeks, that isn't your final result. Yes, you will go back probably to see a surgeon at 6 weeks for a follow-up. And yes, at 6 weeks, you can sort of do a bit more, or you might be able to stop wearing your compression garments. But 6 weeks does not mean you are healed. Most surgeries take 6 to 12 months. So what I'm trying to explain is that you have to trust the process. Lumps and bumps will still be there at 6 weeks, and there will be swelling still at 6 weeks, and this is not your final result. So if you are getting upset that you're not happy because there's this little lump, or there's an area that still looks different or slightly bigger than the other side, or I don't know, whatever it might be for you, that some puckering near a suture line, all of these things, try not to fixate in the early days, and 6 weeks is still early days, on how it's looking right now. You have to remind yourself that even though that bruising has settled, and to someone else walking down the street, they might think you look normal, but that doesn't mean you're healed. There's still so much healing going on internally that you can't see. So trying to not fixate on every small change in the mirror that you might be seeing at this stage still, or worrying that it is something untoward, is a really important thing to try and prepare your head for before surgery, that this is a 6 to 12 month recovery, not a 6 week recovery. And I am not going to assess my results until I am fully healed at 6 to 12 months, not at 6 weeks. And that, I think, for patients can just help them with managing their expectations, that then they're not distressed when this is my result and I've still got this lump here, or this bump here, or this area of swelling. So preparing your head prior to surgery, to trust the process, to know you shouldn't even be assessing your results until further down the road. Just try and be really kind to yourself, and don't fixate on all the small changes that you will have along the way. It will improve, and most of these things settle without any intervention, and you've just got to give it time. Thanks.